All right, today we're talking about one of the biggest headaches in healthcare, those incredibly long waiting lists. But the solution we're going to look at, it's probably not what you're thinking. It's not about just throwing more money at the problem. It's about a surprisingly simple tool, basically a better chart, that is completely changing the game. We all tend to assume that the fix for healthcare delays has to be more funding, right? Or more staff. But what if a huge piece of the puzzle is hiding in plain sight, right there in the doctor's office? What if we could find massive new efficiencies just by helping people have better conversations about their own health? So, before we get to the solution, we've really got to understand the problem. And it's kind of a hidden one. It's this deep seated uncertainty that quietly drives a ton of waste and delay in the system.
Now, this isn't just, being a little unsure about something. Decisional conflict is an actual clinical term. It's for when a patient is so uncertain about their choices that involve real risks and consequences, that they just can't move forward. It causes delays, it causes repeat appointments. Basically, it gums up the whole works. And get this is not a small, niche issue. The data here is, honestly, it's staggering. For things like knee or hip pain, 50%, yep, 1 out of every 2 patients walks into their specialist consultation in this exact state. They are fundamentally stuck with no clear path forward.
So, how do you fix a problem that big? Well, the answer turned out to be this brilliantly simple innovation that completely redesigns the conversation between doctor and patient. They're called the Torbay charts. And you can really see the difference it makes. The old way? It was often just this flood of confusing information that, let's be honest, usually boiled down to 2 options: surgery or do nothing. But the new way? It's like a clear visual map. It lays out over 18 different options, all neatly matched to the patient's specific condition. It basically becomes a shared GPS for making the decision together. And this quote from a patient just says it all, doesn't it? It's the difference between someone telling you where you are versus you seeing it for yourself on a map. That feeling of clarity, of control, it's a total game changer. Okay, so this all sounds great in theory, but does it actually work? Let's dive into the evidence, because the numbers that back this up are genuinely incredible. They show this huge shift in how people make decisions. In fact, the effect is so powerful that the people studying it gave it a name. They call it the indecision collapse, and that's exactly what it is. It's what happens when you totally replace confusion with clarity. So, remember where we started? Half of all patients, 50%, walk in the door completely undecided. That's our baseline. And after just one conversation using these visual charts, that number completely plummets. It goes from 50% all the way down to just 9%. That means almost everyone leaves that room with a clear, confident plan. But here's maybe the most powerful finding of all. If you look at just the group of patients who came in fully expecting to get surgery, well, after having this clear, structured conversation, 1 in 3 of them confidently chose a non-surgical option instead. Think about that. That is a massive shift. Okay, now I know what you might be thinking. Is this just a clever way to talk people out of expensive surgery? Is this just a cost-cutting tool disguised as patient choice? It's a really fair question, and thankfully, the data gives us a very, very clear answer. Now, this number, I know it looks super technical, but what it means is actually simple and incredibly powerful. It shows a very, very strong link between how bad a patient's symptoms are and the treatment they end up choosing. To put it simply, the patients in the most pain were the most likely to choose surgery. So here's the bottom line. This tool isn't pushing people away from surgery at all. What it's doing is helping them make the right choice for their specific situation. The decisions they make are perfectly aligned with how sick they actually are. It's not rationing care, it's making care more rational. And all this new efficiency doesn't come at the expense of the patient's experience. Actually, it's the total opposite. Look at these satisfaction scores. They are consistently high across the board, and the highest score of all for feeling heard and involved. Patients feel more empowered, not less. So what happens when this effect starts to build? Well, the impact of one better conversation, when you multiply it by thousands and thousands of patients, creates this huge ripple effect that spreads across the entire healthcare system. And here's the big headline number. When you actually model this out, the potential savings for just one hospital managing about 2,000 patients a year is over £1.5 million. That's the financial power of a better conversation. and you can see exactly how that chain reaction works. It's really just simple logic. When the right patients choose non-surgical options, fewer operations are needed. That, in turn, reduces the workload for the pre-assessment teams, which frees up incredibly precious time in the operating theater. And the final result of all that? Shorter waiting lists for everybody. So when we step back and we look at the whole picture here, what does all this really tell us? Well, it reveals the incredible system-transforming power of something really simple: clarity. Ultimately, this isn't about making a trade-off. It's what the analysis calls a triple win. First, patients win because they feel empowered and in control of their own care. Second, the staff wins because they get a standardized, efficient tool that actually makes their job easier. And third, the whole health system wins, with huge financial savings and more capacity for the people who need it most. And that leaves us with one last pretty big question. We've just seen the absolutely massive impact of bringing clarity to one specific area of medicine. So just imagine applying this simple principle everywhere. What other complex, costly, and stressful parts of our healthcare system could be totally transformed just by finding a better way to have a clearer conversation?